Imagine this. You're sitting at the table chatting with someone you love. Suddenly, their smile twists to one side, their arm slips down, and their words turn into gibberish. In just seconds, everything changes. That's not fatigue. It's not a headache. That could be a stroke. And in those very moments, a person's entire future hangs by a thread. A stroke is not an illness that creeps in slowly. It's a sudden catastrophe inside the brain. Put simply, a stroke happens when blood can't reach part of the brain. And without blood, there's no oxygen, no nutrients. Nothing to keep those fragile brain cells alive. Think of it like turning off the power to your house. The lights go out instantly. The same thing happens in the brain. Without oxygen, nerve cells start dying within minutes. Scientists estimate that every minute during a stroke, nearly 2 million neurons are lost. 2 million, gone. That's why doctors say, time is brain. The faster help arrives, the more brain you save. The damage from a stroke depends on which part of the brain is affected and how quickly blood flow is restored. For some, it means losing the ability to speak. For others, it's paralysis of an arm or a leg. Some may never write or read again, and sadly, for many, stroke is fatal. The most frightening part? It always strikes without warning. Yesterday, someone walked in the park, and today they can't get out of bed. That's why knowing the signs and knowing how to react is crucial. Now let's look at the types of strokes, because treatment depends on the cause. The most common type is an ischemic stroke. In about 8 out of 10 cases, a clot forms inside a vessel and blocks blood flow. Imagine a water pipe. As long as it's clear, water flows freely. But when it gets clogged, the water stops. That's exactly what happens in the brain. The second type is a hemorrhagic stroke, less common, but usually far more severe. Instead of a blockage, a blood vessel bursts and blood spills directly into the brain. Not only does the brain tissue lose its blood supply, but the leaking blood builds up pressure and damages surrounding areas. And then there's what doctors call a warning shot, a transient ischemic attack, or TIA. Some call it a mini-stroke. The symptoms look the same: weakness, trouble speaking, numbness. But then they fade away in minutes or hours. It feels like a close call, but in reality, it's a flashing red light. After a TIA, the risk of a full-blown stroke skyrockets. So a stroke isn't just a disease, it's a sudden disaster, like lightning from a clear sky. You can't always predict it, but you can understand what happens. Learn to spot the early signs and know who's most at risk. And that knowledge might one day save a life, maybe even your own. So who's most at risk of having a stroke? Many people think, that's something that happens to older folks. I'm still young, not my problem. But stroke isn't only about old age. Yes, the risk increases as we get older, but it actually starts climbing in our late 30s and 40s. From that point on, every decade adds weight to the risk. The number one culprit is high blood pressure. Doctors even call it the silent killer, because most people don't feel it until it's too late. Day after day, high pressure batters the walls of blood vessels, making them stiff and weak. Eventually, one of two things happens. A vessel gets blocked or it bursts. And in either case, a stroke follows. Next on the list is diabetes. When blood sugar stays too high for too long, it damages the delicate lining of blood vessels and makes the blood thicker. This is the perfect recipe for clots. And when one of those clots travels to the brain, it's game over. Heart problems are another big factor. Take atrial fibrillation, for example. It's a type of irregular heartbeat. Blood doesn't flow smoothly, it stagnates, and clots form inside the heart. Then, with a single beat, a clot can be launched into the bloodstream and travel straight to the brain. Now, let's talk about smoking. Every cigarette you light up doesn't just harm your lungs. It constricts blood vessels, raises blood pressure, thickens the blood, and directly damages the vessel walls. Smokers have nearly double the risk of stroke compared to non-smokers, and the longer the smoking history, the higher the risk climbs. Alcohol can be just as dangerous. In small amounts, it's often labeled as safe. But regular drinking still harms the vessels and the heart, and heavy drinking, That's like throwing gasoline on the fire. Blood pressure spikes, vessels weaken, and hemorrhagic strokes become far more likely. Illegal drugs make things even worse. They can trigger a stroke in a 20-year-old with no prior health problems. Obesity and inactivity add more weight to the picture. When someone spends most of their time sitting, metabolism slows down, cholesterol rises, the heart weakens, and blood pressure creeps higher. Carrying extra weight forces the whole system to work harder, straining vessels with every heartbeat. And cholesterol, that's another silent danger. Excess cholesterol builds up inside arteries as fatty plaques. These plaques narrow the vessel and can suddenly rupture, releasing debris that blocks blood flow to the brain. Family history also matters. If parents or siblings have suffered a stroke or a transient ischemic attack, the risk rises. Weak blood vessels or clotting tendencies can run in families. But here's the truth. Even without family history, lifestyle choices often set the stage. A person who smokes, eats poorly, skips exercise, and never checks their blood pressure is essentially building a ticking time bomb inside their own body. So what does all this mean? That almost half of adults carry at least one serious stroke risk factor. The positive news? Most of those risks can be controlled. You can monitor blood pressure, lose excess weight, quit smoking, manage cholesterol and blood sugar. And by doing so, you slash your odds of ever having a stroke. In the next chapter, we'll look at the most important part of this puzzle, the early warning signs. Because knowing how to spot a stroke and acting quickly can mean the difference between life and death. Now let's talk about how a stroke actually shows itself. The scariest part is that it usually comes out of nowhere. No gentle warning signs, no days of buildup. It hits suddenly, and that's why knowing the symptoms can literally save a life. The most common sign is sudden numbness or weakness, often on just one side of the body. A person might try to smile, but half of their face doesn't move. Or they lift both arms and one slowly drops down as if it has no strength. It's shocking to watch and terrifying to experience. Another major sign is speech problems. Suddenly, someone who was talking normally starts slurring words, mumbling, or struggling to say even a simple sentence. Sometimes they can't find the words at all. Even more frightening, they might not understand what others are saying to them. Imagine asking a loved one a simple question and seeing only confusion in their eyes. Vision problems are also common. It can be blurry vision, sudden blindness in one eye, or double vision. It happens quickly and without explanation. Balance and coordination can also vanish in an instant. A person who was walking normally may suddenly stumble, sway, or even collapse. They may complain of dizziness or feel like the room is spinning. And then there's the thunderclap headache, a sudden intense pain that patients often describe as the worst headache of their life. It's not caused by stress, not by tension. It's the brain sounding the alarm. Doctors and emergency responders often use a simple tool to help people remember these signs. It's called the FAST test. In English, FAST stands for face, arm, speech, and time. Let's break it down. Face. Ask the person to smile. If one side of the mouth droops or the smile looks uneven, that's a warning. Arm. Ask them to raise both arms. If one arm drifts downward or won't lift at all, that's another danger sign. Speech. Ask them to repeat a simple phrase like "the sky is blue." If the words sound slurred, strange, or don't come out at all, stroke is likely. Time. This is the most critical part. If you see any of these symptoms, it's time to call emergency services immediately. Every minute counts. Doctors say that during a stroke, the brain loses about 1.9 million neurons per minute. That's why medical professionals talk about the golden hour, the first 60 minutes after symptoms begin. Treatment given in that window can drastically reduce long-term damage. Unfortunately, too many people hesitate. They wait, hoping the problem will pass. They think, maybe it's just fatigue, or let's see how they feel in an hour. That delay can cost someone their ability to walk, speak, or even survive. The truth is simple. Stroke cannot be treated at home. Painkillers won't fix it. Blood pressure pills taken randomly won't fix it. The only right step is to call an ambulance immediately and get to a hospital equipped for stroke treatment. In the next chapter, We'll go step by step through what you should do if you suspect someone is having a stroke, and how those first actions can truly save a life. So let's imagine the moment. You're with someone, and suddenly you notice the signs. A drooping smile, a weak arm, slurred speech. You realize it could be a stroke. What should you do? These first actions are absolutely critical. Rule number 1, call emergency services immediately. Don't wait. Don't hope it will get better in an hour. Stroke is a race against time. Even 10 minutes of hesitation can mean the difference between full recovery and permanent disability. So grab your phone, dial the number, and clearly explain the symptoms and your location. Rule number 2, position the person safely. If they're conscious, help them lie down on their side. This position keeps the airway clear and reduces the risk of choking if they vomit. Place a pillow or folded towel under their head so it's slightly raised. Keeping the head elevated can help reduce pressure inside the skull. Rule number 3, do not give food, water, or medicine. This is a common mistake. Family members often try to offer aspirin, blood pressure pills, or even just a glass of water. But during a stroke, the muscles that control swallowing may not work properly. Even a small sip of water can go into the lungs instead of the stomach, causing choking or pneumonia. And medications are dangerous too. If the stroke is caused by bleeding, aspirin could make it worse. Only doctors, after a brain scan, can decide what treatment is safe. Rule number 4, loosen anything tight. Remove a tie, loosen a belt, unbutton the collar. This helps the person breathe more easily and keeps them comfortable. If possible, open a window or bring in fresh air. Rule number 5, stay calm but alert. Keep an eye on their breathing and consciousness. If they stop breathing or lose their pulse, start chest compressions immediately. Don't worry if you're not trained perfectly. Doing something is always better than doing nothing. Press firmly in the center of the chest, about twice per second, and continue until help arrives. Rule number 6, note the exact time the symptoms began. This might be the single most valuable piece of information you can give to the doctors. Why? Because certain stroke treatments, like clot-busting drugs, only work if given within a strict time window, usually 4 hours. If you know exactly when the stroke started, the doctors can act faster and choose the right treatment. And finally, don't try to transport the person yourself unless you're in a place where an ambulance simply isn't available. Emergency teams are trained and equipped with life-saving tools. They can begin treatment in the ambulance, which can make all the difference before reaching the hospital. Most importantly, try not to panic. The person having the stroke may already feel terrified and confused. Your calm presence can reassure them, while your quick actions may save their life. Remember this formula: recognize, call, position, protect, wait. Everything else will be handled by the professionals. In the next chapter, we'll go inside the hospital to see what happens after the patient arrives, how doctors diagnose stroke quickly and accurately, and why those first tests are so important. So what happens once the patient reaches the hospital? Many people think, we've made it. The doctors will handle everything from here. But the truth is, stroke care is still a race against time. The very first steps doctors take are all about speed and accuracy. The process usually begins with quick questions. When did the symptoms start? What exactly happened? Does the patient have any medical conditions? Do they take blood thinners or other daily medications? This information helps narrow down what type of stroke it might be. Next comes a physical exam. The doctor checks speech, memory, and alertness. They test movement and strength in the arms and legs, ask the patient to squeeze their hands, watch how their face moves. They look closely at balance, coordination, and reflexes. Even the pupils are checked with a flashlight. These simple tests help pinpoint which part of the brain may be affected. But here's the key. None of this is enough to make a full diagnosis. Doctors must see what's happening inside the brain. And that's where brain imaging comes in. The most common tool is a CT scan. In just minutes, it shows whether there's bleeding inside the brain. This is crucial. Remember, treatment for a clot and treatment for bleeding are completely different. If a doctor gave blood-thinning drugs to a patient with bleeding in the brain, it could be fatal. That's why a CT scan is often the very first step in the emergency room. Sometimes doctors also order an MRI. This scan takes longer, but gives a more detailed picture, especially for smaller strokes that a CT might miss. MRIs can reveal even tiny areas of damage, which helps guide long-term treatment. Since many strokes are linked to heart problems, doctors often check the heart as well. An electrocardiogram, or ECG, records the heartbeat to see if there are dangerous rhythm problems like atrial fibrillation. Sometimes they also do an ultrasound of the heart, called an echocardiogram, to check for clots or structural issues that might have caused the stroke. Blood tests are part of the process too. Doctors check sugar levels, cholesterol, clotting times, and sometimes specific markers of heart or vessel health. These tests reveal hidden risk factors that need to be controlled to prevent another stroke. All of this happens quickly, often within the first hour of arriving at the hospital. The reason is simple. Doctors need to know, is it an ischemic stroke caused by a clot or a hemorrhagic stroke caused by bleeding? Because every minute counts, and the wrong treatment could make things worse. Some patients hesitate or refuse scans, worrying about radiation or discomfort. But the reality is, without brain imaging, doctors are blind. It's like trying to fix a broken car without ever opening the hood. A scan is the only way to know what's truly happening inside the brain. So diagnosis is a team effort. The patient's story, the doctor's exam, the scans, the heart tests, and the lab work. Together, they give doctors the full picture they need to start the right treatment, fast. In the next chapter, we'll move on to treatment itself. What doctors do to stop a stroke in progress, and how those first hours determine the patient's future. Once the diagnosis is confirmed, the real battle begins: treatment. And here's the crucial point. The approach depends entirely on what kind of stroke it is. Is it a blockage or is it bleeding? Because the strategies are completely different. Let's start with the most common type, the ischemic stroke. This happens when a blood clot blocks a vessel in the brain. The top priority here is to restore blood flow as quickly as possible. The most powerful tool doctors have is a clot-busting drug called a thrombolytic, or more specifically, tissue plasminogen activator. This drug dissolves the clot and allows blood to flow again. But there's a catch. It must be given within a very strict time window, usually within 4.5 hours from the start of symptoms. After that, the risk of dangerous bleeding is too high. That's why every second matters. If a patient arrives quickly enough, this treatment can make the difference between walking out of the hospital and being paralyzed for life. Doctors call this the golden hour, when the brain still has a fighting chance to recover. If the clot-busting drug can't be used, maybe too much time has passed, or the patient has other conditions. Doctors may use other medications. These include drugs that prevent platelets from sticking together, or medicines that thin the blood. These won't remove the clot that caused the stroke, but they help prevent new ones from forming and reduce the risk of another stroke. In some cases, doctors can physically remove the clot in a procedure called mechanical thrombectomy. Using a catheter, they navigate through the blood vessels up to the brain and literally pull the clot out. This technique is especially useful for large clots blocking major vessels and can be performed up to 24 hours after symptoms begin, depending on the situation. Now let's switch to the second type, hemorrhagic stroke. Here the problem isn't a blockage, but a ruptured vessel and bleeding inside the brain. The focus shifts immediately to stopping the bleeding and reducing pressure in the skull. If high blood pressure caused the bleeding, doctors act fast to bring it down with strong medications. If an aneurysm, a weak balloon-like spot on a blood vessel, has burst, surgery may be required. One method is clipping, where a tiny metal clip is placed to seal off the aneurysm. Another is coiling, where surgeons insert small coils inside the aneurysm to stop blood from filling it. Sometimes bleeding is caused by abnormal tangles of vessels, called arteriovenous malformations. In those cases, surgery, radiation, or injections may be used to block off the malformed vessels and prevent further bleeding. During all this, supportive care is critical. Patients may need a ventilator to help them breathe, or medications to protect the brain and reduce swelling. Doctors monitor heart rhythms, oxygen levels, and brain pressure constantly. It's a full-scale fight to stabilize the body while addressing the root cause of the stroke. What's important to understand is that stroke treatment isn't just about those first hours. It's the beginning of a long journey. Immediate care focuses on saving brain tissue and life itself. But once the crisis is over, the next stage begins: rehabilitation, where the real struggle to regain lost abilities takes place. And that's exactly what we'll talk about in the next chapter: how patients start the road to recovery, step by step, after a stroke. Surviving a stroke is only the beginning. Once the immediate crisis has passed, another challenge begins: the long and difficult road of rehabilitation. This stage is just as important as the treatment itself, because while doctors save your life, rehabilitation helps you get your life back. A stroke often leaves people with serious impairments. Some lose the ability to move one side of the body, others struggle with speech, memory, or even recognizing familiar objects. For many, even basic tasks like eating, dressing, or walking become overwhelming. But here's the crucial point: the brain is capable of remarkable adaptation. With the right therapy, new neural pathways can form, and functions thought to be lost can sometimes be regained. Rehabilitation starts as soon as possible, often within 24 to 48 hours after the stroke. At first, it may be as simple as sitting up in bed, moving an arm slightly, or trying to take the first steps with help. These small beginnings are critical because they prevent further complications, such as pneumonia, blood clots, or muscle stiffness. Physical therapy plays a leading role. Trained specialists guide patients through exercises that strengthen weakened muscles, improve balance, and gradually restore movement. For someone who cannot lift their arm, repetitive exercises, even assisted ones, help retrain the brain. Over time, these movements can return. Speech therapy is another vital component. A stroke can damage the language centers of the brain, making it difficult to speak, understand, read, or write. Speech therapists use targeted exercises, from repeating simple words to practicing conversations. Sometimes they use pictures, gestures, or computer programs to help patients find their voice again. And here's the inspiring part: even when language seems completely gone, many patients recover at least part of their ability with enough training and persistence. Occupational therapy focuses on daily living. Patients relearn how to dress, cook, use utensils, or operate a phone. Therapists also adapt the home environment, suggesting modifications like grab bars, ramps, or special tools to make life safer and easier. The goal is independence, giving the patient back control over their daily routine. But stroke recovery isn't just physical. Emotional and psychological healing is equally important. Many patients experience depression, anxiety, or a sense of hopelessness. Imagine suddenly losing the ability to walk or speak. It shakes the very foundation of who you are. That's why counseling and support groups play a powerful role. Talking to others who have faced the same struggles can provide strength and motivation to keep going. Family involvement is crucial too. Loved ones often become caregivers, learning how to help with exercises, medication, and emotional support. Their encouragement can make the difference between giving up and fighting on. In many cases, families go through rehabilitation together, adjusting their lifestyle to support recovery. The length of rehabilitation varies. Some patients recover quickly, regaining independence in a few months. Others require years of therapy. And for some, full recovery may never come. But here's the key: even small improvements matter. Each regained ability, whether it's moving a hand, speaking a phrase, or walking a few steps, represents a victory against the damage caused by the stroke. Technology is adding new tools to this fight. Robotic exoskeletons help patients relearn walking. Virtual reality systems make exercises more engaging. Brain stimulation techniques are being tested to enhance recovery. The field of stroke rehabilitation is advancing rapidly, giving new hope where once there was little. Rehabilitation is not just about healing the body. It's about rebuilding a life. It's about proving that a stroke does not define the rest of your story. With determination, support, and therapy, many people return to work, hobbies, and meaningful relationships. And yet, even as patients fight to recover, the question remains, how can we prevent another stroke from happening? Because the risk is high, and prevention is the final, decisive chapter in the battle against stroke. If surviving a stroke and going through rehabilitation is a fight for recovery, then prevention is the true battlefield where the outcome of that fight is decided. Because once someone has experienced a stroke, the risk of having another one is extremely high. But here's the good news. With the right lifestyle changes and medical care, up to 80% of strokes can be prevented. The first and most powerful weapon against stroke is controlling blood pressure. High blood pressure silently damages blood vessels, making them weak and prone to rupture. Doctors often call it the silent killer because it rarely causes symptoms until it's too late. That's why regular monitoring is essential. A blood pressure reading that seems only slightly high can, over years, add up to disaster. Keeping it under control, whether through diet, exercise, stress management, or medication, is one of the most effective ways to protect the brain. Diet plays an equally important role. A brain-healthy diet focuses on fruits, vegetables, whole grains, fish, nuts, and olive oil, very similar to the famous Mediterranean diet. At the same time, it avoids excess salt, processed foods, and unhealthy fats. Think of food as fuel for your blood vessels. The cleaner the fuel, the smoother everything runs. And here's something to remember. Small changes add up. Swapping a bag of chips for an apple or soda for water might not feel like much today, but over time it can mean the difference between health and catastrophe. Exercise is another powerful shield. You don't need to run marathons. Even 30 minutes of brisk walking 5 times a week dramatically reduces the risk of stroke. Movement improves circulation, strengthens the heart, balances blood sugar, and lowers cholesterol. It also reduces stress, which in itself is a major contributor to cardiovascular problems. The key is consistency. It's better to walk every day than to overexert yourself once a month. Quitting smoking is non-negotiable. Cigarettes not only damage the lungs, they directly attack blood vessels, making clots more likely to form. Each cigarette increases the risk, and the effect is cumulative. But here's the inspiring truth. The body begins to heal as soon as you quit. Within months, circulation improves. Within years, the stroke risk drops significantly. Alcohol is another factor. While some studies suggest that a glass of red wine may have mild protective effects, excessive drinking is extremely dangerous. It raises blood pressure, weakens the heart, and can trigger irregular heart rhythms that lead to clots. Moderation is key, or better yet, complete avoidance if stroke risk is already high. Medication is also part of prevention for many people. Doctors may prescribe blood thinners to reduce the chance of clots, cholesterol-lowering drugs to protect arteries, or medication to control diabetes. But medication alone is not enough. It works best when paired with lifestyle changes. Mental health should not be overlooked either. Chronic stress, anxiety, and depression increase the risk of stroke. Stress hormones constrict blood vessels, raise blood pressure, and disrupt sleep. That's why relaxation techniques, from meditation and breathing exercises to hobbies and quality time with loved ones, are powerful allies in prevention. Equally important is recognizing warning signs early. A transient ischemic attack, often called a mini-stroke, is a red flag that a major stroke may be on the way. Symptoms may last only minutes or hours, then disappear. But ignoring them is a deadly mistake. Anyone experiencing sudden weakness, numbness, vision changes, dizziness, or trouble speaking should seek medical help immediately. Acting fast can prevent a full-blown stroke. Technology is giving us new tools here too. Smartwatches can monitor heart rhythms and detect irregularities. Home blood pressure monitors allow daily tracking. Online programs provide guidance on nutrition and exercise. Prevention is no longer just about doctor visits. It can be part of daily life, supported by modern technology. In the end, preventing a stroke is about respect for your future self. It's about valuing the years ahead, years of family, experiences, growth, and joy. Stroke does not have to be an inevitable fate. With knowledge, discipline, and support, it can often be avoided. Because here's the truth. The most powerful cure for stroke is to make sure it never happens at all.